Hello, and welcome to another interview with Dr. Eli Sheff for the Sexual Health Alliance series. Today, we're here with Dr. Apryl. And Apryl, I'm sorry, I've forgotten your last name. You just said it a second ago.
Alexander.
Apryl Alexander. Dr. Alexander is a professor of clinical psychology at Denver University in, you guessed it, Denver. Thanks so much for coming, Dr. Alexander. Do you have anything else you want to say about your work at DU or any more introduction of yourself you'd like to make?
Sure. I'm Dr. Apryl Alexander. I'm a clinical assistant professor in the Graduate School of Professional Psychology at the University of Denver. My background and training is in clinical and forensic psychology, and so I primarily teach in the Master's in Forensic Psychology program at our university, as well as do some work in criminal justice systems and juvenile justice systems.
Wow, you sound like a very busy person.
That is right.
And you're also involved with Division 44 of the American Psychological Association. Is that correct?
Yes, I found their task force on consensual non-monogamy and became active and involved there.
And what kind of work are you doing for them? Or with them, I should say, as their collaborator?
Yeah, I was interested in this work and joined on as a part of their inclusive education campaign. So I'm one of the two code leads along with Lisa Dawn Hamilton. What we're trying to do is we saw a lot of gaps in our own education in terms of sexuality and sexuality research. That I teach family systems therapy in my program, and I also teach a new human sexuality class. And when I'm trying to find textbooks, I just cannot find the perfect textbook that highlights everything I want in terms of looking at human sexuality, especially with regard to kind of gender diversity or relationship diversity. So my work on this task force is, what if we reached out to publishers, reached out to other professors to give them the tools that they needed to adequately prepare their own students or colleagues even on these specific topics in, again, healthy relationships, human sexuality, and relationship diversity like consensual non-monogamy.
Oh, that's so great. And so what kinds of, first of all, that's a fantastic idea. That was so smart of you. And second of all, what kinds of materials do you provide them with?
Yeah, so one of the projects that we're doing is we're writing publishers of all sorts of academic textbooks and saying, hey, we noticed that you haven't had anything on relationship diversity and consensual non-monogamy in your textbook. This is something that you want to consider in the future, that we know that consensual non-monogamy and interest in consensual non-monogamy is on the rise. And so people are wanting to learn more about it. We're going to see more clientele who have, again, that relationship diversity. So can you include some of the research that a bunch of our colleagues, just as yourself, are publishing in this area in your textbooks? And then the second is really thinking about education. So for myself, I didn't have any training in human sexuality when I was in graduate school, which was a long time. You know, when I was encountering clients who were having diverse relationship categories, who had this gender and sexuality diversity, I wasn't prepared, and also neither were my professors in talking about these tough conversations. So a lot of what I do now was things that I learned post-graduate degree, which is way too late. My students in our Master's in Forensic Psych program, they often work in communities where they are working with marginalized populations like LGBTQ populations, their families, and also individuals who've committed sex offenses. So they're talking about sex a lot, but don't have a lot of education on what's normative and what's not. Because again, maybe your professors didn't have that education. A lot of my students didn't have comprehensive sex ed growing up. So there's just a lot of gaps there. So our second project is to provide some resources like PowerPoint slides to professors who are teaching these human sexuality courses, who are teaching in marriage and family therapy, to really debunk myths about consensual non-monogamy and have the resources to teach it properly.
Mm-hmm. Oh, that's fantastic. That's so needed. Thank you for doing that. That's just great. I know that you supervise quite a few different practitioners and have a background in clinical psych, meaning like actually serving populations.
Yeah.
Do you have any advice for people who, like the audience for this program is people who want to be really effective and not only knowledgeable, but culturally sensitive and appropriate? You know, like, do you have any advice for people who just want to really do a good job counseling all kinds of different people in consensual non-monogamy relationships?
Again, the biggest gap in my training was I didn't have exposure. Nobody was talking about these issues. So thinking about the importance of continuing education, a lot of practitioners do have to have required continuing education in order to keep their license in certain states. How about we use that continuing education to explore novel topics that we're just not familiar with? Instead of going to the same old like ethics training or the same old clinical skills training, reach outside of your comfort area and start learning some new material. That's what we're seeing a lot, is that, again, people aren't keeping up to date with the research, best practices, new information. So these are kind of some ways in which to get engaged, and I like how ReSpark is doing some of that work in bringing that education to communities. A lot of my work also centers on trauma-informed care and culturally informed practice. And so in order to be a culturally humble like practitioner, you're gonna have to start learning about different cultures and different experiences. And that's what happened for me. My interest in consensual non-monogamy was after working with clients who are practicing consensual non-monogamy. And again, sometimes my supervisor didn't know how to handle it. So it was me trying to do some research on my own to learn more about this population, to become an ethical and culturally informed therapist. And then over the years, again, expanding my knowledge base, just trying to dive into this research. So again, that intellectual curiosity that a lot of people had in their training, bringing that back, because in order to be an effective counselor, in order to be an effective therapist, we need to do a lot of the work on our own. We can't rely on our clients to tell us their stories or to educate us about their practices. That's not what they're there for. That's not their job. It's our job to do all of that background research on our own and bring it to the client and be a knowledgeable and competent practitioner.
So much. Absolutely. So did you, when you were working on your self-education,
Mm-hmm.
was there anything that really was incredibly useful to you? A book you would recommend? And, well, let's start there with the book you recommend, and I'll ask you another question.
Yeah, I mean, some of this work was just exposing myself to more of the feminist literature, exposing myself, again,
Yes.
to some of the classic books out there that I had no exposure to, like The Ethical Slut that everybody knows. So again, I think in my work, I'm trying to expand outside of my even field of psychology, that I think in order to be competent and well-versed, you need to start bridging out into other areas of study too. So looking at feminist studies, spending some time on queer studies. I'm working on my own probably things regarding ableism. So I need to be looking into that community to learn more, to make sure I'm not creating microaggressions, to make sure I'm being an effective counselor. So what I encourage people to do is, again, get outside of your bubble. Whether that is from a learning perspective, whether that's in your own community. So learning about who's in your community, what kind of barriers are they facing. Again, those are the things I've done in my own self-education to challenge myself to do better and be a better person and clinician.
Fantastic. That is really useful. And finally, if you could tell clinicians one piece of advice about what to use in counseling directly, what would you say? Like one piece of advice for, I have often said the therapy room in the past, but now so often we're in separate rooms. So
Yeah.
about the counseling session, one piece of like a tidbit for counseling sessions.
I know we are trained in active listening, but I want you to listen to your clients' stories and narratives. That again, when we're looking at issues related to diversity, we need to get outside of our own boxes, our own systems of privilege, our own systems of power, and think about who that client is in front of us. All of this is being sparked right now, especially with the COVID movement, to be really thinking about intersectional issues. What is going on with our clients of color during this COVID crisis that's disproportionately targeting communities of color? What is happening to our homeless populations? So a lot of times people tell us these stories about their lives, and we might glance over the hardships that they're enduring, glance over some of the hurdles because of our own power and privilege. So again, my kind of piece of advice would be for people to actually listen to these narratives. Don't discount them. And again, start reflecting with yourself and with your clients about how are these systems impacting their well-being and then your even relationship to the client.
Oh, that's so fantastic. Thank you so much for your time and this really valuable information. I really appreciate that.
Yeah, thank you for having me.